Good afternoon, good morning, good evening, everybody, depending on where you're watching from. Today, we are very excited to host one of our current students here at the Bloomberg School of Public Health. My name is Dr. Banda Khalifa. I'm a PhD student here at the Johns Hopkins Bloomberg School of Public Health. So, we have an exciting episode today. We are honored to have Miska Kasahun. I hope I'm pronouncing it well. So Miska is a current MPH student at the number one school of public health here at Johns Hopkins. She also applied to multiple schools and gained admission to all the schools. She's an MD from Ethiopia, and that's not all. She's also a professional model who has represented Ethiopia in multiple international beauty contests. 2016, she was Miss Supranational Ethiopia. I don't know what that means, but she'll explain to us. And then in 2017, she was Miss Universe Ethiopia first runner-up. And then in 2018, she was Miss Africa Beauty Queen, right? Now, she's used her platform to educate the youth and pursue both academic and extracurricular activities and step up of their comfort zones. She's also a co-founder of GIV Society Ethiopia. I wouldn't want to bore you with all her accolades. I'll let her tell her story as we go along. So, Miska, thank you for joining us and welcome.
Yeah, thank you for having me, Dr. Banda. Happy to be here.
Great. All right. So, with all these background, I want you to kind of summarize your journey. Tell us a bit about your background, including your early educational days and any notable achievements apart from the ones we've already mentioned.
Yeah. Okay. So after high school, I went to medical school. My medical school is called St. Paul Hospital Milne Medical College. So I graduated as a general practitioner. I studied for 6.5 years and became a general practitioner. After that, rather than going into clinical medicine, my inclination was more into public health, nonprofit work, communication work. So I worked as an intern in the Ministry of Health of Ethiopia under a healthcare leadership internship. And that really opened my eyes about leadership and about public health. And that's when I think kind of decided that I'm going to go into healthcare management and leadership. After that, I've worked in multiple places like Ethiopia Medical Association, in private organizations. Most of my work was related with like project planning, communication, and also at the same time doing this full-time jobs, I co-founded my own nonprofit organization. It's a volunteer-based organization. It's called Give Society Ethiopia, as you mentioned, and with my co-founder, we basically started giving free medical services, and we started organizing medical outreach campaigns every month with our volunteers, and we specifically tailored our medical outreach to people who were less privileged or had no access to healthcare. During this work, I saw even more that how much public health is impacted by the social determinants and about socioeconomic factors and all the things that actually besides the healthcare aspect, like the other factors that contribute to health in the population. So that I've been working in that in the nonprofit sector for like 3 years now as a co-founder, and I served as an executive director for the 2.5 years before coming to Hopkins. I'm also very much interested in mental health. I do a lot of public speaking, social media advocacy work about mental health awareness. In Ethiopia, I appear in magazines, I appear on TV programs, and just talk about how important mental health is. We also have a mental health related project in our organization called Mental Health for Health Professionals. I also really passionate about mental health of health professionals because I feel like it's very much neglected. So after doing all of these, I also got the opportunity to become a Manila Washington Fellow in 2022. So I came to Rutgers University and spent 6 months being trained in leadership and civic engagement, which also really opened my eyes into um, how much Africa has a different set of problems and a different set of opportunities. I connected with African leaders, young leaders from all over the continent, and it was really inspiring to see the amazing work that was being done.
Yeah.
And after that, that's when I actively started pursuing my master's in public health. I started applying. So I started applying like 3 years back, but then, uh, I was not focused. But after coming
Yeah.
to Rutgers and seeing the educational system, I was like, okay, now this is the time to be
Here's the
really
time.
focused. Yeah. So for 1 year, I was really dedicated about applying. That was all I'm doing besides my my full-time job. Like, if you ask me about anything, nothing mattered to me. It was all about applications and making sure that I get to the best programs and making sure I
Yeah.
get good things. So yeah, so I started applying and I focused on that, and then I got admission to Johns Hopkins University for my master's in public health. So here I am now.
Yeah.
That's a short version of my journey.
That's really short. I can tell.
Yeah.
Anyway, yeah. I mean, that's been. I can only tell how exciting this journey has been, and the kind of lessons you've learned along the way. But at what point did you decide, or who convinced you to venture into professional modeling, or to venture into the area of, say, beauty contest? At what point did that decision come?
Yeah, it's actually interesting. I never imagined I would find myself in a beauty contest. I was more like an academic focused person since I was a kid, and a lot of my elementary and high school students are really amazed when they saw that I went into modeling, because I was a very shy person too.
Mm-hmm.
But it was very random. I was in second year of medical school, and my friend and me saw an ad for a beauty pageant to represent Ethiopia in Poland. It was called Miss Supranational Ethiopia. It's like supranational, like above nations.
Okay. Okay.
So I had a break from school for like a month, and I by nature I don't like not doing anything or like sitting down. So it's like,
Yeah.
I'll just take this training and then build up my confidence and work on my you know self, I guess. So my friend encouraged me, who's actually also a Hopkins graduate. She graduated last year. It's
Okay.
interesting, and her name is Edom. Yeah. Um, then yeah, I went for it. I got the training for like 3 weeks, and then I really didn't think I was gonna win, but somehow I won. And I went to Poland to represent Ethiopia in 2016. Among 80 other countries, there were 80 other ladies representing their countries. It
Mm-hmm.
was the fourth biggest pageant at the time, and it was really interesting to see how people were passionate about this. People used this platform to talk about the things that matter to them.
Yeah.
And it really opened a lot of doors for me, and I was like, okay, this is a very good thing to pursue. So I actively worked on it. I started contacting photographers, makeup artists, making things happen rather than just like waiting for opportunities. So I
Mm-hmm.
went to two, three more pageants, and I also realized that I needed a message in this. I was not just doing it to do it.
Yeah.
So I realized, when I started in my professional journey, it was all about like career and like academics. So I
Yeah.
realized arts can be also integrated into it, and you can be successful in both of them. And as young people, we don't need to be limited. So I decided to send out that message, and I actively appeared on like different mass media and social media platforms and talked about this. And as I said, I'm also very passionate about mental health, so I used it to talk about mental health and how important it is. So that's how it started. I'm not actively working on it now. I'm more focused on school, but it has been an interesting journey.
Great. Great. But do you have any intention going back to that part
uh,
of, or
yeah,
you? Mm-hmm.
I'm not sure. Depends on the opportunities I get, but I'm not actively pursuing it because
Yeah.
of like there's work, there's school, there's personal projects. But if when opportunities arise, I do take them, but it's not as much as I used to.
Yeah. So you're not like actively looking to
Yeah.
pursue those ones. Okay. All right. I think this has been an exciting segment. So this goes to show that you don't only have to be an academic, or you don't have to only be a doctor, right? You can equally pursue your other dreams or your other aspirations, as long as you have the talent for it. I think that's a moving story. Okay, so I mean, I want us to pivot and talk about your academic journey. I know, like you applied to several schools. That might have been a lot of work and a lot of investments going into that. But somebody would ask for someone who, for example, is doing incredible work in Ethiopia, appearing in multiple media platforms, talking about your passion and all that. What really inspired you to kind of say, I think I need a master's in public health, or I think I need to get the best training in the field of public health? What has really inspired you to study abroad?
Yeah, it's a very good question because before I came here, I had a lot going on back home. I was, in a good journey, so it kind of I needed to make a decision. If I stay, it's going to be a completely different path, and if I come here, it's also going to be a completely different path. So, for me, I think being in medical school when I was an intern, seeing all, uh, so I went to a tertiary hospital, so the medical school was a tertiary hospital too. So a lot of like referrals were coming to our hospital, and I saw just like how a lot of problems were not just, as I mentioned, about just specifically infectious disease or like healthcare, but it was also about management and leadership and how healthcare equity was dealt with and things like that. So
Yeah.
it always stayed with me. And also, again, working in the Ministry of Health, I saw how much impact the ministry had and like how it was really affecting people's lives positively, and how like the people in management and in leadership positions and making decisions and policymakers were really impacting a lot of people's lives. So it always stayed with me, even though I went into nonprofits and even though I went into communication work, it stayed with me. So I think my time during my internship in medical school and then my stay in the Ministry of Health really made me say public health is like the place to be to make an impact. I am a person who believes in like large scale impact,
Yeah.
population impact. So that's where it started. Also, my work was nonprofit. My nonprofit organization worked with less privileged people, like with homeless people, elderly, women, and children. And seeing all of that, I realized I really need to understand how public health works and how we can make change in terms of like policy, in terms of leaders. How do we bring out the next public health experts and healthcare leaders? So that's when I decided I also need to get like the best education for that. So I guess it's partly my education and partly my experience and my professional journey that made me decide I need to go into MPH.
Yeah, yeah, and I think maybe it makes a perfect sense with your background in advocacy and youth empowerment, and also in a clinical field. Public health seems like a reasonable pathway. But so how did you select the schools to apply to? What were your criteria? What kind of background research did you do to say that I need to apply to, say, Hopkins, or I need to apply to Columbia? If you can tell us the schools you applied to and what was the rationale behind those.
Yeah. So I think I applied to 8 schools. I applied to Hopkins, Columbia, Boston, George Washington, Washington University in St. Louis, and Rutgers University.
Mm-hmm.
Uh, so what made me select the schools? I had like multiple selection criteria. So the first one, as an international student, is funding. So funding was really important to me. I cannot cover the tuition fees. So funding was really important for me. So
Mm-hmm.
I'll put funding second, but the first one would be like, what kind of program do they have? Is it the best? Is it tailored to what I want? Is it going to give me a good career path after graduation? So the first one was like, how good of a program is the program? That was the first one. Second one was funding. Third one was location. As someone from Ethiopia, the weather really matters to me. Also, the how expensive the city is, the living condition really matters to me as an international student. So that also was the selection criteria. Besides that, how much of an international student do they accept is also another question for me, because I'm really interested in being exposed to different cultures and different professionals from around the world. So it was important for me that they have a lot of international students,
Mm-hmm.
and they're culturally sensitive and aware. So I would say these were my selection criteria. Yeah.
Oh, okay, okay. I think that it's a well thought out process. So I think one other thing that is usually very important is recommendation letters. I mean, a graduate school, recommendation letters are one of the key criteria, or the key elements. What decisions or what thought process went into selecting your recommenders? What qualities or experiences were you looking for in the selection of your recommenders?
Yeah. So the first one was like, how well do they know me? Can they vouch for me?
Mm-hmm.
That was the most important question. After that, I selected people that can shine light on my different sides or on my different experiences. So I had a professional recommender, someone who knew me professionally. I had a recommender that knew me academically from my medical school. I had someone who knew me in my research work, or I had my research advisor from medical school. So
Okay.
that was another side. And then I had someone who knew me from my volunteer work. I volunteered in Global Shapers. I'm a Global Shaper, so I made sure I had someone who could talk about my volunteer work. I also had someone, a mentor, also write a recommendation for me. So what I decided is that just different people can have worked with me in different areas and can show my different sides and my different qualities. So that's how I chose them.
Yeah, I think that makes sense. So another important thing is statement of purpose. And I mean, for those who don't know how to, I've met a couple of people who really don't know even where to start or how to start or how to really make it make sense to the admissions committee. Can you, for example, walk us through, your process of writing, your personal statement? How did you approach it? What key aspects did you focus on? Because you seem to have a very broad, perspective or experiences. How did you decide this particular element is important and has to be on my personal statement?
Yeah. When you start the application process, statement of purpose can be very daunting. I've also, like, you have a YouTube channel, so because of that, I interact with a lot of potential applicants, and some of them, as you say, they don't know where to start. And I also felt like that. Well, I applied to US schools when I was in 12th grade, so it was not as daunting as when I applied for undergrad, but still it was, I didn't know where to start. So that was, I understand what you're asking. So for me, what I do first is I read the question well. So not almost all schools have similar themed questions, but I try to really understand what do they want to know about me, or like, what is this question asking me. So the first thing is to really understand the question. After that, I try to reflect, what experiences do I have? Like, what are my skills? What are my experiences? How do I want to talk about them? Like, which story would be good for this statement of purpose? So I think first of all, you need to reflect, just sit down and just think before writing. So that's what I did. After that, I just like dump all my ideas into either you can use a paper, or I usually work well on the computer, so I just open a Word document and write everything. I don't stress about spelling or grammar. It's just about putting my ideas. It can even be like an outline, like a bullet points. So I'll just put all my ideas in there. So after doing that, I try to see the central theme, or like the story that I can make out of that. Then I change it into a story. I think it's very important to tell a story with your statement of purpose. The admission committee is not trying to, reread your resume or your SOFA's application again. They're trying to really understand who are you, what stories do you bring, what unique qualities do you bring to our program. So I try to select that. So I picked the stories, the real stories that really made me go into public health or made me select that school. So I then used a format of just like a good flow of storytelling, starting from like medical school journey, going into how I went into nonprofit work, how I worked with different organizations, and how that all related and came to make me decide public health is the next step for me. So I think it's showing like how like all your experiences and background kind of come together to make that decision. So after talking about that, then I also reflect why the school really, like what's best about the school. So I read well about their websites. I talk with students who are already enrolled or who graduated. Then I really understand, okay, this school is best at this school. This is why I want to go
Yeah.
to your school. And then at last I will close it with, what do I want to gain after graduation, or what do I want to do with this degree?
Mm-hmm.
Because you're not spending this much money and energy to just gain a degree and just sit down with it, right? You need to do something with it. Yeah. So
Yeah.
I also genuinely, right, like I this is the career path I'm aspiring to go into, so this is where it fits. It's a stepping stone towards this. So that's how I wrote it, and that's my process.
Okay. Yeah. I think it was a well thought out process, very detailed, and speaking to current students or past students is also equally important. Getting people to review your statement, it's critical. And as you said, having an initial draft of everything, right? So all the essential elements in your journey, you want to make sure it's highlighted. And you're not like literally copying and pasting your CV, but you're using it to tell a story that truly makes sense. Okay, but that so okay, but that so how about your CV? What what was unique, or what did you do about your CV that you think it was up to standard, or it stood out in your application?
Yeah. Something that looks easy but or like can be forgotten is just as easy as choosing a good template. Because in
Mm-hmm.
Ethiopia, we have this saying where you're not gonna eat something that doesn't look good. Like they're not gonna. These are like human beings. They're not machines, right? Admission
Yeah.
committees. They're human beings, so they want to see something nice. It needs to be well organized. So I started with choosing a very good template because that can make my work very easy. So that's one thing I did. Then I avoided just like generic words. I really chose words, or like I put the experiences that are specific to me and that I can actually have evidence for. So I think that's what I did. And then I didn't leave out experiences that didn't relate to public health. Like
Yeah.
people tend to just like focus, okay, I went to medical school, that's it. But I added like my event planning, my fundraising, my communication work, my volunteer work, my
Mm-hmm.
modeling job, even though it doesn't completely relate to public health or to healthcare. It shows that I have a wide variety of experiences, and I'm a very
Exactly.
versatile person. So I made sure they can see that. Besides that, yeah, I think these are the points that I
Yeah.
want to write.
And and
Yeah.
Yeah, and as you rightly said, I mean, in applying to public health, sometimes it's not like a job application where you have to be super specific and only put what is relevant to the job on your CV. Public health want to see that you have a broad range of experiences. They want to understand what you're bringing to the table, what element of diversity you are bringing to the table. So if you have any other experiences, whether it's in clinical or non-clinical, it is very crucial to highlight those. And you did it perfectly. Um, so I mean, you got admission to all the schools. Uh, can you share any challenges or obstacles you faced during the application process?
Yeah. So I think choosing schools was not easy because um, how do I put it? So I actually started applying for spring semester. So one challenge was that there's not a lot of funding for spring semester. So that was one
Mm-hmm.
challenge. Then it was choosing between schools because these are all very good schools, and some of them they're located in cities that I really wanted to be in, like Colombia. I really love New York, and I wanted to be
Yeah.
in New York, but New York is really expensive, and the funding I got from Colombia was not a lot. So I had to make choices
Mm-hmm.
between schools, like which one ultimately will take me to the career that I want, and also
Yeah.
makes the duration of the program smooth, because you don't only want to choose a school that looks good on paper. Like, you actually want to enjoy the time that you're gonna spend there. You don't want extreme challenge. You don't want to go to a very expensive city and have a miserable 2 or 1 year time. So I also I think I had to make choices, and then I really wanted to stay close to the Ethiopian community, and so and also where my relatives and my family lives. So the
Mm-hmm.
DMV really made sense to me. So these are like some of the things I had to think through between choosing schools. I wouldn't really call it a challenge, but it took me a while to be like, okay, which one has good funding, but still will give me a good outcome after graduation and things like this. Yeah.
Yeah, yeah. I think well that is equally a good criteria. I know people funding is usually a critical component. Location. So to you, it seems like location was a good criteria for you to kind of decide on which school to pick, and then obviously like the quality of the program, it's also was also part of the process. So eventually you decided to come to Hopkins. um uh so and I'm glad that like Hopkins too has a lot of diversity in terms of the student population. And we've beginning to see a lot of students from Ethiopia, which is like really cool. So yeah, I think, I mean, your academic journey is interesting, and it lays down a very solid foundation for people who, for example, don't know what to do to kind of start. So for someone who's trying to apply to schools of public health, what is the first step that you would perhaps advise them to do?
Yeah. I think doing a very good research is important before just like haphazardly starting a statement of purpose or just like going to SOFAS and applying. Really sit down and make a research. I think watch YouTube channels like yours that are very good. People these days, I love that they love to share and they love to help out, so that makes it much easier. So watch YouTube channels, make your research, read, talk to students first, and then understand, okay, what is the process, so that you can make a timeline. Because I've seen people who didn't have an idea of a timeline, so they would start the SOFAS application really late, and then they would have their IELTS on time or their recommender would be on time, so things like that. So
Yeah,
really understand the timeline. When is my deadline? So if my deadline is December, so when should I start approaching recommenders? When should I finalize my statement of purpose? Things like this. Actually have like a written or like a Word document and write down this timeline, so that makes it easier for you, so you don't wake up one day and realize you're really behind or something. So yeah, have a timeline, research, and then I think we need to be disciplined. Applying for grad school is kind of like a full-time job. It really needs commitment
yeah, hmm,
and discipline, because a lot of people from all over the world who are really good are also applying to the same schools
yeah,
for the same funding that you're
hmm,
applying. So if you don't have commitment and if you don't have discipline, it can take you a couple of years to actually get admitted, and it can take more time. So I think you need to decide, okay, this is the amount of energy and time I'm going to spend, and you kind of need to visualize yourself achieving that, so that it's easier for you to work on it. Besides that, I think really talk with people who've gone to grad school. I know most grad school students are busy, but most of them that I know are very happy to help. So have brief phone call conversations, or like write to them and understand and get your statement of purpose reviewed, your resume reviewed. Ask for help. You don't have to do it all by yourself. I mean, if you're extremely good and if you're very independent, good for you. But I don't think that's a good idea. It's easier to seek out help, because like for me, it really helped me having to talk to people who already were in Hopkins, who especially people from your country. Like for me, Ethiopians really helped me. So because they understand the culture and then they can communicate with you easier. So this would be my short version of my advices.
yeah. I mean, that is very crucial. You've highlighted a very critical aspect: doing your research, right? So doing your research, know the timeline, know the program requirement, know the things you have to do, reach out to people, being organized. So someone reached out to me last week that he wants to apply to School of Public Health, and it's like 2 weeks to deadline. So how are you going to apply? I said, oh, he has already sent a message that they should submit his recommendation. And I said, so how are they going to do it? Have you heard of SOFAS? He said, no. Have you heard of West Evaluation? He said, no. And I said, no, then you're not ready to apply this year, right? So if you haven't done any research at all, and you reach out to people that you want to apply to School of Public Health, that is not how it's done. You have to invest your time and do the research. So thank you very much for this advice.
Yeah, you're welcome.
And I know like one of the major hurdles for international students, it's acquiring a visa, right? So I've seen a lot of students get admission, some even with scholarships, but I'm not able to get the visa and come for their dream school. So for you, how was the visa experience like? How was the visa interview? The overall experience, how was it?
Yeah. Um, the overall experience was okay. Unlike most students, I already went to the States on a J1 visa last year for
Mm-hmm.
Mandela Washington Fellowship, so I was a bit. I felt like I'm okay. I don't
Yeah.
really need
Uh-huh.
to do much research, and because if you have travel history, but I was proven wrong actually, because after the interview went because I was prepared. I had all my documents that I needed, and I was asked. So by the time at the interview, I think I've had like 70% of my funding covered. I had an
Okay.
external scholarship and some from Hopkins. So, but then I was planning to fill out the 30% from a family that lives here. So
Mhm.
the visa person was really focused on asking me like the shocking question was like, why would your relative help you? I'm like, what? That was a question I was not ready for. I was ready for all the questions. I was like, it took me a few seconds to actually like come up with an answer. Like, he's my
Yeah.
relative. You want to support me? I got into a really good school, and this is my dream too. And yes, of course, like family supports each other. But well, I didn't say that. I answered how I'm supposed to answer it. So, but then again, I like at the moment that day there was a lot of applicants, and there was only one visa officer. So the visa officer was like, oh, I need time to see your documents, so I'm going to refuse you visa. And I was really shocked because I was so sure that because I have travel history, and because I
Yes,
got
yes.
accepted to Hopkins, and then I have all this funding, and I couldn't like believe my eyes. And he was like, we'll email you the decision, but he took my passport. So that
Yeah.
was a
Uh-huh.
very, yeah. So for 2 3 days, I didn't know how to feel about things. I was actually sad because like everyone, just like also my friends and family were sure that I was gonna get it.
Yeah,
So
yeah.
everyone that kept calling me. It was like, it's okay, you'll get it. But yeah, so after like 3 days, they're like, oh, we've processed your documents. I guess you just needed time. So there can be like a lot of unexpected things like this. I've had friends who had to apply twice, 3 times. They've been denied because of small and like small, seemingly small things.
Yeah.
So it can be challenging. So I think you have to be prepared. Also mentally, it can be a very like depressing thing when you're denied, but you have to try again and again, and you have to, I guess, be prepared for anything, because I was not prepared for that refusal, and it really bummed me out for 2 3 days. Yeah.
Yeah. I mean, it's sometimes people go with less compelling stories and they get visas. Other
Yeah.
times people like go with like a solid story that that, oh, they ask for this, there's no way they're gonna deny the person, but eventually they will say no, or let's put it in administrative processing, review it for a while and then see what happens. So it's good to prepare well, gather your materials, talk to people who have gone through the process and the kind of questions to expect and how to really answer them. I think that was helpful.
Yeah.
Um, so eventually, it was successful. You've got into Hopkins. When you got to Hopkins, what was your first impression of Hopkins? and the city itself. What was your first impression about Hopkins?
Yeah. Um, for the city, it was interesting. Baltimore is an interesting city.
Mm-hmm.
So when I came to for the in 2022 for Mandela Washington, I was in New Jersey. I had an opportunity to visit DC, Maryland, Florida. So the places I went to compared to Baltimore are different. So my idea of United States or you know, was like a bit different. So Baltimore was a bit of a shock to me.
Yeah.
It's an interesting city, so it took me a while to get used to it and to appreciate like the different sides it has. And Hopkins, I was like really excited and like was like at first it was really nice to see all these international students. We started with an international student only.
Yeah.
Um, Orientation. So it was really nice to see people from all over the world and to see how the faculty was really helpful and they're willing to answer questions. I think that's one of the things that also made me choose Hopkins. Like during my interactions before admission, even they're very fast and very respectful, very professional, willing to help. And I saw that when I came to. So uh, I felt like I was coming home or something. Like they don't make you feel like you're like in this new place, and because they really help you to figure things out, and they're willing to work with you and with whatever challenge you have. So yeah, it was exciting coming to Hopkins, and also we had well, compared to other times, a big Ethiopian community. There's like 7 of
Mm-hmm.
us in our cohort, so we're always together, we're always talking Amharic. So it's like, oh, I didn't feel like I was that far away from home. So was a very good experience when I first arrived to Hopkins. Yeah,
Yeah. Somebody says, "Oh, as for the Ethiopians, they are always together."
yeah,
Yeah. So, so I guess I mean in terms of adjustments, it's been relatively smooth for you because of the Ethiopian community. But are there any other areas that you're finding it difficult to adjust? Let's say in terms of academically, or how is the culture here different from back home?
yeah. I actually faced a lot of challenge that I was not prepared for. So most of us, when we apply, we kind of forget that we'll get accepted and then there's life will continue. It's all about getting accepted and getting funding. So we tend to not research about what is the culture that I'm going into, what is the school community like, what is the area about, and like what are common challenges. So I don't think I focused on that. So I had to learn on the process. So some of the challenges I faced, for example, in terms of academics was, so Hopkins has a 1-year master's program. It's actually 11 months, and then you're taking 80 credits, and most of us are doing part-time jobs, trying to understand the professional world. We have personal projects. We're coming into making new friends, and we want to have social life. So academics was really tricky to actually get used to, because it's really fast-paced. Before you know it, in like 4 weeks into arriving to Hopkins, you're doing your midterms. So that was like really fast paced. So I had to really get into my academics mode, because I've been away from school for like 3 years. So I had to retrain myself to go with the pace. So academics is actually challenging. It's still challenging for me, but I'm trying to learn and trying to use different methods, like having study groups, talking with others. That really helps. So that one challenge is academics. Second one is, I think, just like getting used to the weather, the food. It's completely different. Like things are not organic here, so that's like you have to exercise because you're sitting down a lot of times and you're just like staring at a laptop. Your health can be really compromised. So all of that was really tricky to me. So because we also really focus on academics, we tend to forget about taking care of ourselves, our mental health, physical health. So I had to be conscious about the things I eat, how I spend my time, how I exercise, and things like this. So that was also challenging. The other one is just like having to make new friends, and because Hopkins is big, our cohort is big. It's around 200 or more students. So
Yeah.
you want to be friends with everyone, but you can't be friends with everyone. You don't have enough time. You need to study. So yeah, having to find like-minded people and people that you can share your stories with, or like become friends, and potentially in the future, lifelong friends and colleagues. That also was tricky. you need time to make friends and to make connections.
Yeah.
Well, yeah, I think these are some of the major challenges.
Yeah, I mean, these are almost like the same for all international students. The academic environment is fast and busy, and everybody's going to class almost every day, right? So it can get really overwhelming. But apart from your academic work and you know going to class and other academic projects, what other activities are you engaged in? I know it's just 11 months, but you still have to be able to engage in some, work like clubs, community service. What are some of the activities you're interested in exploring?
Yeah. So I'm actively trying to be involved in different like student groups. I'm a member of African Public Health Network, so I hope to contribute to that. Besides that, I like curating events. So for example, for Ethiopian New Year, we had our classmates over and we shared our culture, our food, our music, our dance. So things like this, I like planning events where people come together and just like share like, their experiences and make friends and kind of like networking too. So I tend to do those things. Besides that, as I said, DMV has like a lot of Ethiopian community, so I go to Ethiopian events. I try to make connections. I have some projects in mind, so I work on that. I try to go for hiking and things like this because I love hiking. Besides that, I'm also an intern for a mentoring platform in Hopkins. It's called One Hop. So with that, I do a lot of networking and I work with alumni and with other also interns in the mentoring work. So yeah, I try to make sure I stay involved in both personal Ethiopian and like international communities because that's really important to me.
Great, great. Hopefully that Ethiopia event next year you will invite me, because this year you guys celebrated it without sending me an invite.
Yeah. That's
Anyway,
that's that's not true. I did invite. I sent you an invite. I just forgot to remind you. You were invited.
yeah. Anyway, I mean, I saw the pictures. It was really nice.
Yeah.
Um, okay, so you made mention that you got some funding from Hopkins and other external sources. So basically, your main source of funding is from Hopkins, or
I
majority
also
of
have
it.
external funding. So 70% is from Hopkins. The rest 30% is from an external funding for women's. It's called American Association for University Women (AAUW). I'm an
Okay.
international fellow,
Mm-hmm.
so yeah, almost all of my tuition fee is covered by the external funding and by Hopkins.
Oh, okay. So is there like a particular name for the Hopkins funding, or it's just um
Yeah, it's the Dean's scholarship. Half of
okay,
it is Dean's scholarship. Half of it is I think that it's called MPH scholarship. Yeah.
okay. Well, that's exciting. Um, all right. Let's all this after your MPH. I know, like, you probably do OPT or something, and then with your previous background, what are you looking to do in the future? What are you looking to do with the MPH, your MD, your you know uh, role in advocacy and all that? What is the vision you have?
Yeah. My interest is more again related to healthcare management and leadership. I want the healthcare leadership to focus on people who don't have access to healthcare. I'm really passionate about health equity and serving people who are underserved and who are less privileged. So my interest is more related to low and middle income countries. I would like to work in that area. I'm also very much interested in mental health. Mental health services need to be provided in a much more frequent and accessible and affordable way. Again, in low and middle income countries. So my interest is mostly in working in Ethiopia within the health equity and the mental health aspect. Yeah.
Awesome. All right. So, trivia questions. 5 trivia questions. You've explored Baltimore enough. What's your favorite place in Baltimore?
I like the inner harbor. I like taking a walk. Well, not now during the fall and winter, but in summer term, it was nice to just like after exams or after a long day of studying to just like take a walk at the inner harbor.
Great. I know like a lot of people love the inner harbor. If you could travel anywhere in the world, where would it be and why?
Uh, I'd like to see so many places, but I think I'd love to see Singapore. I've heard really good things about Singapore and how sophisticated the community is and how differently they do things in a sustainable manner and things like this. So it would be interesting to go to Singapore.
All right. Do you have any favorite cuisine or dish that you've identified in Baltimore?
Not yet, not yet. I mean, I've been exposed to like different international food, so I don't think I've tasted anything different yet. Uh, Yeah,
You've not tasted any Ghanaian food yet?
no,
Okay.
but I've had Ghanaian jollof rice before, but not in Baltimore.
Okay. I hope it was nicer than the Nigerian one. Anyway,
Yeah, I think Ghanaian jollof rice is better than the Nigerian one,
okay.
and I'm gonna get a lot of backlash for this one.
All right. Can you share one fun fact or unusual fact about yourself that a lot of people don't know?
Um, that's a very hard question. Um, I I like to dance. Maybe that's an interesting fact. I love dancing to all types of music. Yeah.
Okay. If you could pick any African country to have been born besides Ethiopia, which would it be and why?
This one is easy. It's South Africa. I love their culture. I love their music. I'm obsessed with Amapiano, and I love their accent, and I just feel like their culture is very interesting and different.
All right. That sounds great. I think that is all I have. Any final words for um your your friends, family, viewers from Ethiopia? I know you have a YouTube channel, so you can perhaps describe. Tell us a bit about channel, and then we'll give it a day.
Yeah. Yeah, my YouTube channel is also just like you focused to help grad school students for now. It's called Miskir Kasahun, that's Dr. Miskir Kasahun. So for now, my segments are in Amharic, so I'm focused on supporting Ethiopian grad school applicants. I go through all the process that you need to do. I give advices and share like my personal experiences. So if you need that help, yeah, please do subscribe. And besides that, for anyone who's applying, I know it's a very tough process and it needs a lot of discipline, but you'll make it and you'll get to the place that you want to be if you're preserved, and also if seek out support and make like really good decisions and become disciplined. So I would say you got this. Like a lot of people have imposter syndrome when they apply. They don't feel like they're worse, going to like the big schools, but that's not true. I'm sure everyone has like amazing achievements and amazing stories to tell, and they can go through the process. So yeah, my advice is like stay strong and you got this.
Awesome, awesome. Well, thank you so much for joining us today. Hopefully, our viewers will take some key points and information from this insightful conversation. Thank you so much for your time.
Yeah, thank you for having me. I also really appreciate the work that you're doing. I know you're supporting a lot of students, and we really, in the name of all the applicants and students, we appreciate you and the work that you're doing.
All right. Thank you. Bye.